Yep, Jan, the camera's on. We're all just waiting.
In anticipation. Well, yeah. All good things.
Morning, Jane.
Good morning. Good morning. Good morning. Busy weekend coming up for you.
Till the end of the year. I mean, the end of the,
End of the year, okay.
to the end of October, which is kind of what I'm thinking is a
Seems like
year.
the end of the year.
Yeah. It's like, if I can get to the end of October. Yeah, because we have our Inuit premiere in the last weekend.
Yeah.
So we're just kind of winding up. Yes.
You make accommodations for them too when they come?
Oh, yeah. And entertain them and feed them and, yeah, and introduce them and blah. Yeah. Yes.
I don't know if we can make the flowers last that long.
Oh.
Planters?
Oh, right. No,
Yeah.
it's okay.
I'll look today.
Yeah, they look good today. But that's 10
That's
days
10
from now.
days,
Yeah, or more. Yeah.
All right, since everyone is here, sorry to interrupt, baby stories are very important. We will start the Public Health and Human Services Board meeting, October 16th, 2018, at 8:30 a.m. Just a reminder for all of us, microphones close to your mouth but not touching your lips, since it seems that there is difficulty in people hearing us with our new recording system, so.
Jerry, good morning.
We've had a couple updates on that. Approval of consent agenda. Does anyone want to pull anything? Okay, can I get a motion to approve it?
So moved.
Thank you.
Jan,
I'll
and then,
second.
or Myron,
Myron,
and then
then
Jan.
Second.
All in favor?
Aye.
Aye.
Okay, staff report, financial assistance program, Allison.
Good morning.
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 All right. Look at that, no one's here. They don't want to hear that. All right,
We're here.
so,
We're here.
They're all getting,
We're here
they're
for
all
you,
getting
Allison.
their flu shots.
Yeah.
all right, so there's a little PowerPoint that I'll go through to provide my update. So the financial assistance programs and services that we provide include the programs listed. We have child care assistance, and so everything is known as an acronym. Pretty much in the agency, there's like hundreds of acronyms. So child care assistance, people know as CCAP. We have a couple different programs for cash assistance to assist families. So that means that there has to be minor children in the unit. And those include the Minnesota Family Investment Program, known as MFIP, and the Diversionary Work Program, which is DWP. And then we have some cash assistance for single adults, so no children in the unit. And that would include general assistance, known as GAA housing support, which was formerly called group residential housing. And then we have Minnesota supplemental assistance, which is also known as MSA. We also have emergency assistance available for single adults or families as well. That program is to assist when that unit is at threat of losing an item of basic need like housing or utilities. We also work with the Minnesota healthcare programs. You think of medical assistance, Medicare savings programs. Those programs help cover the cost of Medicare Part B. Then we also have long-term care services and a reimbursement program called Healthcare Access. And then one of the biggest ones is that as a federal program is the Supplemental Nutrition Assistance Program, also known as SNAP. So the populations that we serve with these programs include all county residents and residents who are in placement out of our county. So that could be people who are in treatment, foster care placement, or supportive housing. We serve all ages. We serve people with disabilities. We serve families and single adults, as mentioned before, with the cash assistance programs. People who are employed, unemployed, and the main requirement from program to program is income eligibility. So in terms of the income eligibility, it does vary greatly depending on the program. So for example, like the county burial fund can be for burial costs for those who have no available resources, or family who don't have any resources available to contribute to those services. And then on the other end of the spectrum, the highest income limit to qualify for assistance would be infants for medical assistance, and they can qualify with a household income up to 283% of the federal poverty guidelines. So to give an example of that, for a family size of 4, so if you think mom, dad, 2 kids, they could be making up to a little over $5,900 per month, and that child could still qualify for medical assistance. Or yearly income, that would be a little over $71,000. So again, there's quite a broad spectrum for income eligibility for these programs. So an update on our caseload. So our caseloads continue to grow or remain steady. Our healthcare programs, our family cash programs, and child care assistance show the greatest growth. Start this morning. So this one is showing, depicting the CCAP, the Child Care Assistance Program caseload. The font's bigger on your screen than it is mine. So as of September of this year, so most of the data is up through September because obviously October hasn't finished, so the data isn't complete. But as of September, there were 15 CCAP cases, and as you can look throughout the beginning portion of 2018 and into 2017, we've had some pretty high numbers, maybe 18 cases, 17 cases, kind of fluctuating month to month, just kind of depending on where people are at with getting forms in and whatnot, but still considerably higher than the past years. We started seeing a large boom back in the spring of 2017, where the caseload went from 11 or 12 up to 15, 16, 17, 18. So we definitely saw a lot more activity with families going on to that assistance program. And then just to note too, that I currently am the only financial worker that is trained to work with the child care assistance program, so that's something that I do in addition to my supervisory role as well. Essentially looking at having another financial worker, or maybe our office support case aide position, go to the training in order to take over that caseload. But currently right now I am still the sole financial worker for that program. Oh, I did want to mention too, one thing that is different, a big change that we've seen is there's been no wait list. We've had no one on a wait list for our basic sliding fee funded childcare since February of 2018. I mean, historically we've had like 10 plus families on our wait list, and we were able to get a lot of families on to CCAP, and other families on the wait list no longer needed it. So as people call right now, we can pretty much give them an application right away to look at eligibility. Family cash. So again, looking at MFIP and DWP. This program's were at an all-time high of 38 families enrolled in October of 2016. So we have steadily come down, seen a decrease from that that high point. Right now, September, we're looking at 20 families. It was a little higher in the spring and the winter, 2017, 2018. But those shifts we do tend to see in the winter months, a little more assistance potentially needed, especially because of all the seasonal employment that we have in the county. The SNAP caseload. So you can kind of see a lot of them are all kind of been very steady and consistent. All of the lines are fairly well grouped together. In September, we had 122 families receiving SNAP. And again, if you compare the lines, the enrollments for 2017 and 2018, the participation rate is still fairly similar between those 2 years. The Minnesota Healthcare Program caseload. So this includes, again, medical assistance and Medicare savings programs. In September, we were at 605 families that were enrollees in those healthcare programs. Let's see if there's anything else. Enrollment still remains steady with 2017, between 2017 and 2018. So looking at a snapshot, a point in time, September of 2018, so just kind of reviewing some of those caseload numbers, we had 199 people receiving SNAP. So again, that takes it down to a person per person level. We had the average benefit for those on SNAP was about $91.88 per month.
Per person?
Per person. 20 families were receiving cash and food assistance through MPIP or DWP. So that included 20, so out of the 20 families, that was 20 adults and 42 children. The average benefit per person is $244.93 per month. And over half of our MPIP participants are working, so they have a source of earned income. 29 adults without children were receiving cash assistance through GA or MSA. So again, general assistance or the Minnesota supplemental assistance. So we have their average benefit per person on GA. I broke these out because there's a significant benefit difference between general assistance and MSA. So GA, the average benefit was $133.70 per month, and the average benefit for those on MSA was $34.93 per month. So this population is generally unable to work. Most are recipients of or applying for Social Security, Disability, or SSI. And GA is really kind of that stepping stone feeder program to help support individuals while they're applying for disability benefits. That's why it's not a huge monthly benefit like you would see for the family cash assistance programs. We currently have, as of September, 1,008 people eligible for medical assistance. We do utilize 2 different programs to determine eligibility for individuals. The one program we call METS, which is also known as like the MNsure Exchange, the online platform. We have 877 people determined eligible through that program, 433 of which are children, so quite substantial. And then in our other program, which is called Maxis, which is the same program we use to determine all of the other benefits, food support, cash assistance. That program is utilized to determine eligibility for those that are elderly or disabled. And we have 130 people determined eligible in that system, 34 of which are children. And then along the lines with medical assistance with the Minnesota healthcare programs, we have 89 people receiving help with their Medicare costs through one of the Medicare savings program. And again, that program helps cover the cost of the Part B premium, which basically $134 per month. You know, if that's covered, that can be a substantial savings to those individuals who are not otherwise seeing it deducted from their monthly retirement benefit. Emergency assistance. So these are county funded for homeless residents or those facing housing crisis. So again, like eviction or potentially a utility disconnect. Funding is limited. So looking at a snapshot of 2018 so far, we've made payments in the amount of almost $2,000 through our MFIP crisis fund. So again, this would be the funds used for families that have those emergencies. At this point, we have not made any payments for single adults, which would be through our emergency general assistance funding. 2 households at this point have received assistance. Again, that would be for the MFIP crisis funds. So looking at the fiscal year, I suppose we would call it, our funding year for emergency assistance, the MFIP crisis funds is a calendar year, January through December. General assistance is staggered. That's a July through June of the following year. And again, these payments are made to prevent utility disconnect, past due rent, to prevent eviction. Those are the main ones that we see. In terms of our average allocation that we see towards these 2 funding sources, typically the allocation for MFIP is about $4,000, but this year we saw an increase. We allocated $5,000 towards that emergency funding. And then the emergency general assistance is approximately $1,000 per year. Staff updates. So currently we have 3 full-time financial workers working in the cash, food, and medical programs. We have, again, I had talked about those 2 systems that we work with. We have 198 cases in the Maxis system and 451 cases in the METS system. We have 1 full-time and 1 part-time financial worker working with the long-term care programs. So Aubrey Smith is our full-time worker. Pat Strand, as you guys are quite aware, she's been with the long-term care service programs for quite a while. They work in a shared caseload of 52 cases right now in the Maxis system. We also have our office support case aide position, Sarah Schoonover, who works out at the front desk, and she is a big asset to our team. And some of the tasks that she does, besides answering phones, and transferring those to the appropriate individual, she does all of our scanning of our documents into the electronic case files. She does the initial entry of the applications, renewals, anything like that she does into the system. She issues EBT cards so people can get their SNAP benefits right away if they don't currently have a card. She is also our healthcare access coordinator. She took that program over from Ellis when Ellis transitioned to a financial worker position. And that program has definitely kept her quite busy, especially as we've done more outreach for that program. And so, again, she tends to take on a lot of tasks that she is able to do without a lot of the more formal training that we as financial workers go through. That's why she's not technically a financial worker, but there's a lot of tasks that she's able to take on and assist us with. Some of the operational changes, so program improvements and efficiencies. So we've seen several changes over the last couple of years that Allison had started implementation of that have really created efficiency and improved the service that we're able to provide. We do have a shared email that goes to the income maintenance team, and that's to just help funnel, to create one pathway for whether it's people internally, social services, clients, or even providers outside of the courthouse. If you think like medical providers, employers, everything you get funneled to this one email account, and it's maintained and checked on daily by the scheduled intake worker. And this has really been a great way to communicate with all individuals, because we can share files. Sometimes it's easier, instead of calling, just a quick pop off an email and someone can respond when they need to. And then we do see continued expansion and improvement with the tools related to our usage of our EDMS system. Our EDMS is the electronic data management system. So if you think of like the online case bank, the online case file, not the paper file, we don't use those anymore. Everything's stored electronically. We've seen a lot of improvements in that system over the last year that's helped create some efficiencies in our workflow processes. Previously, all of the documents related to METS cases, or you think MNsure cases, everything was processed by paper. So if we received paper in the office, it would go into just some files, and then we would pull out paper when we needed to process something like, oh, this person had a baby, we need to add a newborn to a case. Well, now with the improvements that we've seen, those documents along with all other documents are still scanned by Sarah at the front desk, and then they route electronically to we can see them on our workstations for processing. So it's a lot less fumbling having to try to go find a piece of paper where everything is right there accessible on our screen. So our performance goals. So the state has some requirements when it comes to processing. There are specific timeframes and guidelines in which we have to process applications for benefits. Let's see here. So in April of 2017, so when Allison was the financial assistance supervisor, our performance was below the threshold that the state requires, and you can see that little dip. So the threshold is 75% timely processing. So basically, to arrive at that percent, we look at all of the applications received and what were the number of those applications processed by a 30-day period. That's the standard required processing for applications, is 30 days. Unfortunately, there were a lot of changes going on in our office, and we were working on Allison was working on getting more financial workers hired, but you can see we dipped down below that threshold, so we did have a performance improvement plan put in place by DHS. So our processing was then monitored going forward, and at the end of 2017, we were at 90.5% of our applications were processed timely. So a significant jump from 73% up to that 90%. So because we were significantly above the threshold, they actually closed that performance improvement plan basically like a year early because we were rock stars. Rock stars. And then as you can see, our continued performance just continues to increase. Right now, through through July, they didn't have September data, we're at 95.23% of our applications are processed timely.
Jan?
Thank you, Madam Chair. So would you attribute some of that performance, obviously we have new leadership, so I would credit some of it to new leadership, but also being fully staffed. Does that?
Oh, absolutely. I would say fully staffed along with, in a sense, fully trained, because our financial workers who are working on these programs have gone through the SNAP training, they've gone through the healthcare program training, they've gone through family cash training. So all of that is very significant because it just lends to more financial workers being able to process the applications that cover all spectrum of programs. Mm-hmm.
And then there must...
Experience to build, and so you feel more comfortable knowing how to process those applications.
Makes sense. And is there a financial component benefit to the county with those improvements?
I think, Allison, you can correct me. I believe that there are some bonus funds available, specifically I know for like SNAP processing. That comes more from the federal level in terms of looking at how states are performing, and then if bonus funds are received by the state, then the state will distribute them probably a ratio determination to each county. We got bonus funds, I think, in 2017?
Yes, that's exactly correct, that our bonus funds are allocated, SNAP being a federal program, to a state. So we're all in this together in a sense. All counties and tribes that are administering the program would be working together to be eligible for that bonus. But in terms of the local benefit, not having a performance improvement plan is certainly a cost benefit for the agency, because we aren't having to monitor caseloads, do the reviews, report back to the state. So we're seeing a savings in that regard as well.
And the people are being better served.
Absolutely.
So that's a huge, that's a huge benefit. Thank you.
Better service.
Better service, thank you.
So kind of going off those lines, there's also what we call expedited food support, expedited SNAP. So expedited SNAP is available in specific situations. So this would be like applying units with less than $150 in monthly gross income, and they have less, $100 or less in liquid assets. So if you think like money, cash in their pocket, money in their bank accounts. There's also destitute migrant or seasonal farm worker units. We don't have, to be honest, we don't see those types of units up here. It's just not the type of population that we have up here in Cook County. And then the other type of common unit that we see that could qualify for expedited food support are the units whose combined monthly gross income and liquid assets are less than their monthly housing costs and applicable utility, standard utility deductions. So basically what happens is when people come in to apply for food support, there's a little box on the front of page 1 of the combined application form, and it asks, please answer these following questions so you can be screened for potential expedited food support. It asks, what is your, for the unit, what is your expected monthly gross income for this month? What is your, what do you currently have in cash, checking, savings, bank accounts, etc.? So what are your current liquid assets? And then it asks, what's your monthly mortgage or your rent expense? And then what utilities do you pay for currently? And then we will screen them and we'll look at, okay, well, where does their income sit in relation, I should say income plus their assets, sit in relation to what their expected monthly expenses are. And so if their expenses are higher than their income, then that would indicate a potential need for food support benefits immediately versus potentially waiting up to that 30-day processing window. So when someone is screened, potentially eligible for expedited food supports, we offer an interview right away. An interview is required for any of the financial assistance programs. And that's in order to acquire more information and to confirm the information that they put on their application. And then another thing, if someone is determined eligible for expedited food supports, they actually can provide verifications of income, their shelter expenses, things that are typically required before we approve benefits. They can actually provide those verifications after they've already received their benefits. Those are called postponed verifications. So another way of speeding up that process of like, we need to get them benefits right away. They can't wait for this. So we'll give them benefits and then we'll make sure that they provide those verifications after the fact. So typically processing is within 5 business days. Our typical unwritten, I guess, processing standard that we like to see those processed by are within 24 hours, if not 2 business days. And so I pulled the chart to see where we were at with our timeliness for processing those expedited applications. So we've had 23 expedited eligible food support applications. We have processed 21 of those, and this is up to current year-to-date figures. We've processed 21 of them within a 24-hour period, so that's 91% of those applications. And then looking at the 5 business days, we've processed 22 out of those 23 applications timely, which would be 95%. And then there's some stipulations depending on potentially up to 7 calendar days, but again, our goal is to process within 24 hours, if not on an additional business day. Now, you may look and be like, well, what happened to the 23rd application, for example? You know, sometimes, unfortunately, people turn in an application, they're screened expedited, we try to get a hold of them to do an interview, and sometimes we never end up being able to get a hold of someone, or they never attempt to call us back. There's a lot of different circumstances that are out of our control, but we do make several attempts to get a hold of people to conduct that interview so we can start that process. Another performance goal is the MFIP Self-Support Index. So this is an outcome measure that is mandated by the Minnesota legislature, and it's a one way to measure the success of that Minnesota Family Investment Program and the Family Care Program. So it's based on original goals of MFIP, which is to increase employment and earnings and decrease the use of cash assistance. So you really help supporting those families to self-sufficiency, where they no longer need to be a recipient of these programs. So it looks at how they measure it is they look at every adult receiving MFIP or DWP in a quarter, and it counts how many are off assistance or working at least 30 hours per week 3 years later. We do have an expected range of performance based on unique factors specific for our county, like what's the population that we serve and what's the local labor market like. So looking at our self-support index for 2017 and 2018, and this looks at a period from April of 2017 through March of 2018. We are within our performance standards. So the low end of our performance would be a little over 65%, and the high range, the upper range, would be at 84, a little over 84%. And we're kind of like in the middle a little bit at sitting right below 75%. And success in this performance measure is really dependent on our partnership and communication with our local tribal and employment services providers, and even with the Child Care Assistance Program, working with those families. To be self-sufficient and to go to work, they need to have access to and help in that assistance in paying for that quite expensive child care cost. So there's a lot of factors that go into these performance measures and families obtaining or striving for that self-sufficiency. So looking ahead, some kind of key factors, staff development. We are always looking to cross-train and develop staff training and that staff experience. You never go to training and that's all you're ever going to learn. There's always ongoing educational opportunities. So for example, next week, all of the financial workers are going to be attending the Minnesota the Minnesota Financial Worker and Case Aid Association Conference. And that is a 3-day, Wednesday through Friday conference that offers multiple little mini education sessions. And that's going to be in Maple Groves, Plymouth, down in the cities. And we went last year, and it was a great opportunity. So again, all of the girls, Agni, Dagmara, Ellis, and Pat will be attending that conference next week. I will be here. So if you need assistance or questions, I will be here.
That was my question. Who processes applications if you're all gone?
Me. So I'll be doing a lot of that intake work stuff that the girls would otherwise be doing. And then there's always opportunity for regional trainings. Recently, our region partners and other region financial workers have created a foster care 4E group because that's a complex program, and just having that support from other financial workers, and then our DHS liaison is part of that group, and they try to meet monthly, so we have that option of traveling in our region to attend this group and work through some of those processing questions. And then St. Louis County is working with DHS at trying to get a regional training in Duluth for the housing support program that was formerly called GRH, the Group Residential Housing, again, a complex program. That program Doug Mara solely works with, or is the sole financial worker that works with that program. And that again is a complex program. So it's nice when some of these trainings can be brought up versus having to always send someone down to St. Paul. Another thing that we're currently going through is our 2018 SNAP ME review, or it's a follow-up. So it's a SNAP management evaluation. We had a SNAP ME review back in 2016, and so this is kind of a follow-up to ensure that we have those ongoing performance and outcome measures that are being met. And those reviews are nice because it recognizes our strengths and potentially like deficiencies in our processing, like, oh, you forgot they need to do this per the manual, or, oh, someone forgot a case noted. So some of those kinds of things are great to get that feedback on because we have to be doing them. So I just submitted last week, we had to do 10 reviews, and the reviews are separated into 2 categories. One is a payment accuracy review, so basically was information about the individual's income, shelter expenses, do they pay child support, some of those types of factors that go into their benefit calculation. Did they receive the right benefit, the right calculation? And then the other one is a CAPER. Everything's an acronym, CAPER. I'm trying to think of the
Case act something procedural error.
yeah, just call it CAPER. It's hard to remember what that one stands for. But basically, it's looking at programs that were denied or terminated. What was the reason? Was it valid? And were all steps followed properly because you're ending someone's benefit. So I had to do 10 of those combined and submitted them. So we'll just wait to hear back if there's any positives or negatives with our processing. Policy reviews is another thing that's high on my priority list for this year, is to review and update our policies. I have already drafted an update for our county burial fund, and Allison has that, and we'll go into the next steps of reviewing that, and hopefully eventually get that one approved. But that policy has not been reviewed or updated in 13 years, not since 2005 is when it was last approved by the board. And then some other of the policies that we're looking at would be like our crisis funds, so our emergency assistance policy, and a state recovery as well, which we don't really have a policy on, but that's something that we're really starting to dive into. Plowman has really started to spearhead the estate recovery process. Software enhancements. So we're seeing several enhancements to that MET system. So again, the MNsure, the online exchange. The state has really tried to implement some kind of cross-referencing, double check kind of processes for those cases. So we have one that's called a periodic data match. So typically people who have eligibility determined in the MET system. So again, through MNsure, they've applied through MNsure. It's all client attestation. So when people apply, it asks you, what are your income sources? Like, so how much do you make biweekly? How much do you make monthly? And then tell me what is your anticipated annual income. So people, it's assumed that they're using their current information and calculating accurate, truthful figures. But sometimes there's changes, maybe that figure no longer applies, maybe some people, I don't want to imply anything, but maybe they aren't including some sources of income. So this periodic data match is a way for the state to randomly select cases and actually cross-reference their income sources with other electronic data sources like the IRS, Social Security Administration, DEED is another one now. And it's really to help check to see if there's any discrepancies between the information that clients have provided versus what electronic sources are saying potentially they have for income. Because that ultimately, if their income figure on their case is not correct, they may not be eligible for the program that they're currently on. So that's a new process that is put in place, and they just went through a testing phase. They're reviewing the outcomes from that testing phase, and then hopefully we'll implement it full board going forward here, beginning of 2019. And then there's another process. It's called reasonable opportunity period. So METS had always attempted, it was always connected to electronic data sources, again, like the IRS, Social Security Administration. It wasn't always doing these periodic data checks like I just mentioned. But when someone applies, it tries to check those sources to see, okay, did the person apply with an income that is reasonable to these electronic data sources? Or can we confirm this person's social security number through these electronic data sources? If not, if the system kind of put up a flag like, hey, we're not sure if this is accurate, we need more verification, a notice would get sent out to clients saying, please turn in paper verifications of these items to your local agency for further processing. In the meantime, people could still be eligible for these programs, and you're assuming and anticipating that they're turning in these verifications that the system is saying they need to submit. Not everyone turns them in, but then they would remain eligible for these programs even though they weren't necessarily complying with turning in required verifications. So there's a new process in place now that will actually end their eligibility after like a 45-day period if we have not processed a paper verification for an item on a case like their income. So a lot of these, again, a lot of double checks going on. The state is really trying to be, they're trying to be more proactive in making sure that people are cooperating with program requirements and instilling those processes actually into the computer system. And then another software enhancement, the appeal. So when people appeal any aspect of their financial assistance determination, before it would be a paper process. They call the state, they have to file a paper appeal. Documents would be submitted to the state to back up why we did something we did. Now everything is going to be electronically online. People can apply online, we submit documents online. So now instead of, okay, only one person has a copy of the paper file, now it's accessible by multiple people in one location. Again, trying to create some more efficiencies. And then just in general, METS, again, that MNsure online exchange, besides a couple of enhancements that I just mentioned earlier, it really has come a long way since it first debuted before I started working for Public Health Human Services. It's a complex program because that system determines eligibility for medical assistance, Minnesota Care, private health programs with the assistance of tax credits, or if you're not eligible for tax credits at all, it determines you eligible to go in and just purchase a private health plan. So looking at that full spectrum of what it can do, there can be some bumps along the way, but the state has really come a long way in improving that system, which then makes our jobs easier to work with a program that the kinks are being worked out in. And then the last one, I think maybe Allison will touch base on this later, is the health plan procurement, which will start happening. DHS is going to start that process for the 2020 contracts for the health plan providers for like the health plans that provide people their medical assistance coverage. And we're done.
Any questions? Jerry?
Thank you, Allison. This was really a good report, so clear and well stated. I have a comment under the heading of healthcare access. This statistic of 1,008 people receiving or perhaps eligible for medical assistance struck me as pointing out what an important program medical assistance is, because if I understand this right, without it, about 1 in 5 people in the county wouldn't have health care insurance. And think about that,
Yeah.
what that says. And then as far as healthy living in the community without health care coverage, what a difference that would make for so many people and for the quality of life here. So.
And it's not a program that we work with, but Minnesota Care. So once people pass the income threshold limits for medical assistance, the next program that they could be potentially eligible for is Minnesota Care. In Minnesota Care, I don't have the figures, but that we do have quite a few residents in the county eligible for Minnesota Care as well. And it's very similar to the services provided by medical assistance, except now because of the higher income, people now are having to cost share, contribute towards the cost of that program. So then they start paying a monthly premium, which is determined by their income level. But again, another valuable program that we see residents of the county being enrollees in as well.
Myron?
Yes, thank you. So this 1,008, looking at the state average, are you aware of what that is? Or I'm just wondering where we're at compared to the rest of, or northeast Minnesota. And
I don't have those
Okay.
figures offhand. I can get back to you on that.
I'd be curious, it's not really that.
Great figure to look at.
Yeah, what I'm getting at, and follow-up to that is, you know, I hear going about in the community that our housing costs are high. So do you see that as an impact with these, statistics? In other words, I'm sure housing costs are factored in some of these qualifications for certain services.
Correct. So it's limited. The number of programs that look at the housing costs is very limited. It's
Okay.
really solely the food support program
Okay.
that looks at the housing costs.
Okay.
And that is when people provide verification of their mortgage, rent,
Sure.
and then depending on the utilities they pay for, there's a deduction from their income, which then helps determine a final benefit for them. There's no deduction for shelter costs for the healthcare programs, not for the family cash programs or the single adult programs. It's really solely based off of income. The family cash program, DWP, the diversionary work program, so that's a very that's a short-term cash program. It's a 4-month period, and then people could always transition to MPIP. That program is different. It doesn't allow a deduction from income for those housing expenses. However, the program helps pay for those expenses. And so there's not really a cash benefit, a huge cash in the pocket to the client benefit for that program. Instead, it pays for those expenses. Not necessarily up to 100%. There's a substantial amount of calculation that goes into it, but people can get assistance towards paying those that rent or that mortgage and towards those utilities. And through that program, if someone's determined eligible for that assistance for those shelter costs, there's a direct payment that actually goes to those vendors to make sure that those expenses are covered instead of paying the client and then hoping the client pays the vendor. That program will direct pay like Arrowhead Cooperative or DW Jones Management kind of thing. So unfortunately, yeah, there's not too many accommodations or deductions for many of the programs for those housing costs, even though that is a huge concern up here.
Okay, so at least you would substantiate that it is a concern based upon your experience?
I would say so. I mean, just speaking in terms of what we see our clients dealing with, there's limited housing, and in doing their interview and discussing with them their shelter and utility costs, again, depending on the program, if we can deduct that from income or not, that higher expense in our county has a huge impact on our clients, especially low-income families already, and then then they have that burden of having to pay a high rent or utilities because, you know, say subsidized housing like Birchwood, there's only so many apartments available, and if there aren't any apartments available, then people are having to rely on housing that's not subsidized, and they're having to pay full price for it. So we see many spectrums of that, the shelter expenses affecting people.
Thank you.
Ginny?
Thank you for this great report. It's simple, and it's easy to follow, and it's kind of daunting at the same time. But I appreciate all that. So I have a couple questions. On the burial fund, is that available for folks who are in already a program with the county, or can someone outside the programs apply if they need help? How does that work?
Absolutely, yes.
Okay.
They don't already have to be a recipient of another financial assistance program. They can be completely new to applying to a program. Like, suppose with the burial fund, they're not applying because unfortunately they would have passed. But like a family member applying for an individual who was never a recipient of a financial assistance program. Absolutely. It's just like with any other programs, when the need arises, people can apply, and then ultimately it's just that application process and determining if they meet the requirements to receive a benefit through the program.
Is there a set benefit, or does it depend on the income that they have?
Specifically for the burial fund, that depends on the deceased's remaining income for the month. So if they had sources of income for the month, what is left over, do they have any leftover liquid assets sitting in bank accounts, for example. And then some people on Social Security their family may receive a death benefit. So those are some of the things that we look at. Basically, are there any available resources after the individual has passed that can help fund a service? Or if it's a family member, a surviving spouse, anyone, or even a close friend, we've had close friends apply for individuals, are they willing to or able to contribute anything to the services for that deceased as well? So those are the main factors that go into that county burial determination, is just really what are the resources remaining that could help fund that instead of the county funding it.
So do you have very many cases? Any requests?
Let's see, we do have several requests. I think we've maybe had, I should have pulled that number. I want to say we've probably had like 5 applications this year. Unfortunately, just like with a lot of the other programs, you know, if they're not determined eligible, then we have to deny them.
So you do get some
Yes.
We maybe fund about 1 or 2 burials in a given year.
in a given year. And just a matter of semantics with words, going back to cash assistance for families, you call them units. Do you mean households?
Household units, yeah, it's trying to stay away from like the policy lingo. So units is like the unit that's applying. Typically it would be a family. It's different depending on the program, what's considered a unit. A unit are the individuals that have to be included to determine the specific benefit. So for SNAP's an easy one. The food support. So typically, if you look at a family, let's say mom, dad, 2 kids, they would be a unit. But sometimes you have mixed households where you have mom, dad, 2 kids, you have an aunt and an uncle, or maybe you have like a grandparent, but everyone purchases and prepares food together. They're one unit because they purchase and prepare food together. So all of those individuals, their sources of income, their shelter expenses, for example, everyone's information is used to determine their benefit.
Interesting.
So sometimes, you still, even in a mixed household, it could still be a family. But yeah, so It's just kind of policy legal unit, yes.
Okay, thank you very much.
Jan?
Thank you, Madam Chair. I'm going back to the Child Care Assistance Program caseload, and I'm just curious about, because this seems child care assistance is a serious issue, and I'm hoping we're addressing it, and the statistics show that this has increased a fair amount. It looks like it started increasing in late 2016, and if you look at 2018 numbers, they're almost double of what 2016 numbers are. And so did the standards change, or has the need changed, or combination?
I think there's a variety of factors. I didn't get the breakdown of the funding sources for CCAP.
Okay.
So CCAP can have several different funding sources depending on the situation for the families. So any of the families that are on a family cash program like MPIP or DWP, there's always funding available. There's, if you want to think of it like unlimited funding, it's not capped for those individuals. And again, that's because you kind of need to pair child care assistance for families who are looking to work in order to help them achieve self-sufficiency. So that's why there's that uncapped funding stream for those individuals. So as we've seen an increase, either remaining steady or an increase, or I would say even maybe just a change in families on MFIP, we've seen the need for child care assistance differ as well depending on that family's need. And so I've seen, again, I'm sorry I don't have the breakdown, but I've seen more families on MFIP and DWP also then
Makes sense.
Apply for child care assistance. Some families, depending on their child care situation, maybe it's a family member who takes care of their kids. So there's some instances where people don't actually use a provider who's registered to receive those child care assistance reimbursements. So again, not every family on one of the family cash programs necessarily needs it, but I've seen a change in that where people are actually utilizing a local provider. The other main funding source that we see families on is the basic sliding fee funding for child care assistance. So those are individuals who are not on one of the family cash programs. It's a capped allocation that can fluctuate from year to year. The state determines an allocation based on past usage and spending for a county. So, and there are certain thresholds. So let's say if the state allocates $40,000 to our county, but we spend less than, maybe, this is like a Lori question. If we spend less than, I feel like it's 90% in my head of that funding, and that could be because maybe we're not servicing a lot of child care assistance families. Then the following year, the state will see, oh, well, they didn't utilize their full allocated amount. We'll go ahead and reduce their amount and allocate it to a different county who's overspending. So there's some fluctuations with that funding. We've seen some increases over the last couple of years. And that's part of the reason why we no longer have a wait list, is because we saw some shifts in our caseload along with a slight increase in allocation that we could now service more families.
Got it. I forgot that kind of coincides with the wait list. They used to be wait listed.
Yeah. So
The need stayed the same, yeah. Okay.
And if I may add just one more consideration too to this, is that in 2015, we, the staff member who was determining eligibility for child care assistance was also a part-time accounting technician, and that was one of the staff positions that we added in 2015-2016, was to move her full-time to accounting so she could really focus in on that work and bring on a financial worker who worked primarily with the family cash programs and with the child care assistance programs, which are really a cohesive set of programs to be working with, because you're working closely with these families already. You can do outreach and say, well, did you know that because you're receiving this benefit, you can also get assistance with your child care? So that's one of those factors that I think certainly contributed to our growth and our ability to serve more people.
So better service. That's awesome.
And just kind of the natural shifts too within the individuals who are already receiving assistance. Kids who are full-time at childcare because they're too young for school age, as those kids age up while being in the program, once they enter school, now all of a sudden, you know, we're not paying
Sure.
full-time care because they're now in school. So some of that funding, basically, that was previously allocated for their care, kind of gets freed up to add another family. But still, while that one family remains on child care assistance, because they can still receive reimbursement for like those school out days, or there's no school in summer, so then they go to a provider in the summer. It's just we may be spending less for one specific family, depending on how those kids age out into, again, school, and where less care is needed throughout the year.
Complicated, as usual. Thank you, Allison.
Anything else?
Both Allisons.
I have one clarifying question to ask on your staffing slide, Allison. So 3 full-time working in cash, food, and medical programs, 1 full-time and 1 part-time working in long-term care. You're counting Agni in both of those banks, correct? She's a full-time worker working in cash,
Yes,
food, and
she
medical.
works with cash, food, and medical, and then just specifically for the long-term care programs, she is counted again along with Pat.
So we have 3 full-time financial workers, 1 20-hour-a-week, which is Pat Strand in long-term care, and Allison Plummer, who's a supervisor but also has her child care assistance caseload. That makes perfect sense.
It could be included in the full-time cash, food, medical, because I still do processes.
Thank you so much.
Thanks so much for what you do. Good to see that improvement.
All right, director's report.
Thank you, Allison, for that report. That always holds my interest, of course. That was the area that I came from. So a timely announcement from the state that Governor Dayton signed a proclamation recognizing tomorrow as Financial Worker and Case Aid Day in the state of Minnesota. So I will just briefly read through that proclamation. Whereas county and tribal financial workers and case aides are dedicated to providing outstanding service to the people of Minnesota through their administration of public assistance programs, and county and tribal workers and case aides are responsible for the prudent expenditure of millions of dollars annually and must meet high standards of job performance in determining eligibility for public assistance. And whereas the duties performed by the county and tribal financial workers and case aides require that they be well-versed in a number of areas in order to effectively provide services to clients and the general public. And whereas the nature of federal and state legislation necessitates that county and tribal financial workers and case aides continually expand their knowledge, skills, and expertise related to their profession. And whereas it is important to recognize the valuable services county and tribal financial workers and case aides provide for Minnesotans, always delivering culturally responsive case management, accessible community services, and a person-centered focus. Now, therefore, I, Mark Dayton, Governor of Minnesota, do hereby proclaim Wednesday, October 17th as County and Tribal Financial Worker and Case Aid Day. So I want to express my gratitude to Allison and her team, Sarah Schoonover, Sarah Hadley, Alyssa Smith, Katie Smith, Dagmara Smith, Agni Smith.
Wow, I didn't realize.
Ellis Welch and Pat Strand. I think I got everyone, right? Yes. Our dedicated financial workers and case aides, and Sarah, who provides oversight for the case aides in the front office. So thank you all for your work.
How confusing.
Huh?
All the Allisons and all the Smiths. You
Allisons
can't
and
call
all
and
the
ask for Mrs. Smith.
And the Sarahs. And we're really excited to announce that we have another Grace joining our agency.
That's great. We don't want to take on new names, yeah.
Excellent.
So as you saw on the consent agenda, Grace Greniger accepted our offer for the public health coordinator. So we're really excited to have her joining the agency. She will be starting with a distance orientation effective November 1st. She is relocating to the community, so we're getting her set up with various accesses that she'll need. And we had a lot of success with this with James Zimmer, who was hired for a distance orientation. So we're glad that she's able to get started on some of the training and using our video technology to connect with her before she's able to relocate to the community. So she's hoping to start on site in early December. Grace is currently serving as a program supervisor at a Twin Cities area nonprofit service organization. She has a master's in public health and really extensive experience in grant writing, program evaluation, community health education, and bringing together community advisory groups. So we're really excited to have her join the team.
Awesome.
We are still representing 2 public health staff in the budget. I'll be sharing a revision to our 2019 budget today. We are in the process of transitioning family home visiting to the Sawtooth Mountain Clinic, when we'll hope to have an addendum to present in November to start compensating the clinic for some of the work that they've already been doing with us in planning for this transition. But we are still representing that second public health staff person in the budget. We're anticipating to just be reallocating those funds to a line item for our master contract with the clinic to transition the universal family home visiting services. But do see potential, maybe not in 2019, but just really want to hold on to that allocation of funds for public health. Still see a lot of opportunity to do more in preventative care, and knowing that the return on investment and the community benefit is so high when we are doing preventative work in the community. So is there opportunity to bring in some additional grant funds to support a position, be it part-time or full-time? So it's just something that we're considering as we're bringing on a new public health staff person and transitioning the skilled nursing component of public health to the clinic with the family home visiting. We met with HDC a couple weeks ago to hear about some of their plans for transition after the resignation of Matt Webb. This is a big loss for us. Matt provided a lot of services for Cook County and for PHHS in particular. He provided clinical supervision to a couple of our mental health staff here in PHHS, and provides therapy services as well. And HDC has been down a therapist now since Cecilia left earlier this year. So we met with them to hear about some of their plans for the transition and what that might look like. Certainly using ITV in the interim. But HDC also shared with us that they received a grant, pretty significant grant, to expand behavioral health services, chemical dependency, and mental health, and the announcement just came out for that. So again, we're still learning from HDC about what that would mean for Cook County and how that could benefit our population. With losing Matt, we're also losing the leadership of Marin Webb, who's been such a great asset to the community and our agency through her coordination of the SHIP program, her work with active living, and other community initiatives. As I mentioned, the clinic is moving forward with taking on the Universal Family Home Visiting Program, and they are pursuing funds through the Community Health Board to study whether they could implement an evidence-based program that other counties within the region are looking at. So I'll continue to bring updates to this group as we learn more. I will be at the Budget Committee this afternoon, but wanted to share with you some revisions that we have made to the 2019 budget. So what we have done here is removed the additional case aid position that was a position that we were proposing to bring on some support services for people experiencing chemical dependency, substance use disorder. We just truly feel that there's so many unknowns still with direction from the state and the feds about implementing that program that we will not be pursuing that position in 2019, waiting until we learn more. So that has been removed from the budget. And we have made some adjustments to our assumptions for adult mental health. So the net change for the 2019 budget for PHHS is a 1% reduction from our initial levy increase. So we've removed that position, but again have increased our budget assumptions for mental health placements for adults. We had initially scheduled our next community health assessment stakeholder meeting for next Tuesday, October 23rd. We will now be rescheduling that, knowing that Representative Eklund and Senator Bach will be visiting that same afternoon. So we'll send out notice today to work group members who have been involved or invited to participate in that process to date. We're looking at the following Tuesday, October 30th for a reschedule, but are open certainly to rescheduling for early November if that works for the majority of the group. The PHHS management team had the opportunity to attend a one-day workshop in Duluth yesterday. So we just got back yesterday afternoon. I was really grateful that everyone was able to work, and it was something that we could do as a team. We're still a very new team, with Allison being in her position just under a year. Lori just reached 6 months in her position as fiscal supervisor. And it was nice that we could find something again nearby with minimal time out of the office. And I think that everyone got something out of that we can bring back to our teams and our group. And we'll hope to bring an update here in a future director report that I can share some of the work that we're doing. We had 2 of our licensed programs audited in October and September. The Wilderness Outpatient Treatment Program was audited by DHS, and then the In-Home Support Program, our 245D licensed homemaker respite transportation provider, was also audited. We have yet to receive formal notification from the state of the results of those reviews, but the initial response was quite positive. Everything seemed to be in order. We're working with our Public Health and Human Services Advisory co-chairs to discuss the formation of a local mental health advisory council. This is something that we have recognized a need to address. It's a statutory requirement that counties have a local advisory council for mental health. And we had been working to incorporate some of that work into our existing Public Health and Human Services Advisory Committee, certainly addressing mental health quite a bit in that group. But as we began to dig deeper into the requirements, knowing that we have to have a number of consumer representatives, and knowing just how busy and engaged our Public Health and Human Services Advisory Committee has been, that we truly couldn't devote enough time to meet the needs for this group. So we'll be, again, bringing more to you as we talk about the formation of this council. We'll certainly be discussing in more depth at our next Public Health and Human Services Advisory Committee meeting. And again, we see this really as an opportunity to blend well with our community health assessment, community health improvement plan, which one of our strategic priority areas is behavioral health and substance use. Allison mentioned that we are looking at reprocurement for managed care plans for people who are receiving health care through medical assistance, Minnesota Care, with a prepaid health plan. So we just received notification from the state earlier this month that the procurement process will start in 2019 for 2020 enrollment. So 2020 would be the soonest that any consumers would see a change. And the state is working with counties to gather information on the various health plan options. We received a grant, PHHS received a grant from the North Shore Healthcare Foundation to train 2 public health and human services staff in Circles of Security, which is an evidence-based parenting education program. Currently, there aren't any services like this in the community, and just really want to credit the Early Childhood Coalition. Grace Bouchard, Joni Christensen from our agency have participated in that, and Sandy Tanzer, who wrote the grant on behalf of PHHS. Really excited about bringing this service to the community, and it'll be the first step in building a multidisciplinary team in this service. ISD 166 also received a grant from the North Shore Collaborative, so we'll have staff from various agencies trained in this program. PHHS set up a shelter site last week. Was that just last week? In response to the sustained power outage after our windstorm. So that was at the YMCA. Set up the shelter site after we found that there would be a number of people who would be without power through the night. There wasn't anyone who presented with a sheltering need, no calls to dispatch or to the phone line that we had set up for the shelter. And again, just thankful for Joni and Valerie and their leadership in emergency preparedness and response, and that we're thankful that, at least to our knowledge, no one had that need, and it's just always a great exercise for when the need truly does present to be able to build those skills and what do we need to do to set up a shelter site and who we need to work with, and really the multi-agency collaboration that's required in those types of responses, with maintenance to get the trailer up to the YMCA and the YMCA to secure the space and to have access to the building.
Is there any kind of program assistance for showering? That was one of the responses that I heard from people without having power. They had to pay full price to shower at the Y, and they were talking about in other counties there's assistance for that.
We had a board program meeting last night, and we talked about that, and I think there was some mix-up a little bit, and hopefully there'll be some debriefing, but we had recommended that there'd be no charges and that we'd advertise it. I think there was just, people were caught a little bit on the Y staff that next morning, you know, what should we do the day after? And so I think there was some confusion, but I think we've worked that out with the Y, you know, that we would offer those and advertise that people could come in and shower. And so I think that'll take care of it, but maybe there could be some kind of debriefing to cover those kinds of things, because there was some confusion about that. And I don't think there's anyone to blame, it just was people were just sort of caught not knowing what to do at the desk the next morning.
Well, the Y advertised that the shower was available to the public with the price, so.
Well, I think that was initially, you know, the policy, but in an emergency, we would not have that.
Yep.
I think
Sherry?
Along the same line, during a power outage like this, what happens with people who might be on oxygen and need to have access to power to run a concentrator or something like that?
That's why we open the shelters.
That was part of it, and Joni was working closely with Kimber Ralstad up at the hospital to identify a space within the hospital and care center for people who needed access to outlets.
Okay. Were there
could use
people
the
who
generator.
did come for that?
Not to my knowledge. Again, we haven't had a formal debrief of the situation, but I do know that the resource was available or identified anyways.
I wondered if the general public is aware of this, and if there could be something in the paper that, if there is, I mean, you could call dispatch to find out if it's open.
WTIP puts out, because that's the easiest for people to get access to when the power's out, and then we do have lists of people we reach out to that we know, but there's probably people we don't know that have
Well, I mean, if you don't
situations.
have power and you haven't thought about it, you can't access WTIP.
You have to have battery-operated radio.
Which, everybody does, right?
we should encourage battery-operated radios.
Yeah.
There are certainly
That
lots
came
of
up, too.
factors.
Emergency
That's a good
radios, yeah.
idea.
I stream
Yeah.
it, which doesn't
That takes,
take power till you run out.
yeah. Solar adapters for computers.
And I go charge it in my car.
But I think it would be good to have some kind of debriefing with people that were involved in that, just so that we can work out some of the glitches.
Yeah, I don't doubt that that's on Valerie's radar, but I will follow up with her.
I'll
about
talk to
that.
her, too.
Yeah. So there's lots going on in public health and human services, certainly, always. Lots of change. Change is constant, but lots of good things, too. And just, again, really grateful to all of the staff, the advisory members, volunteers, community partners, everyone who comes together to do this work. It really is just my pleasure to see it all happen.
Jerry?
Another question, Allison. Where are we at with the Family Connects program now that we're talking about transitioning of these universal family visiting to the clinic?
Yeah, so we're hoping to keep Family Connects on the table as a potential evidence-based program that we've done the research on to know that this could be a good fit for the community, but also see opportunity for working with our regional partners and knowing that other counties in the region, Carlton Lake, St. Louis, are looking at this other program, Healthy Family America. And really, as a part of this transition, knowing that the clinic knows a lot more how to best serve their population, and that we certainly have a role in the assurance and the oversight as the public health agency, but that we aren't so firm, and this is the model that we have to use. We want this to be a successful transition. We want to have a program that best meets the needs of the community, and that's why we're having more conversation about what could work. Certainly, universal program is a priority. We want to continue to serve all families of Cook County who want to participate in the program.
All right, we've got 2 items for action.
Any questions about the items for board action? I can just say that the HDC contract, this is specific to that innovation grant for persons with disabilities in the community and supporting them to find employment services. This was a request, I believe, from HDC to have this additional agreement between our agencies. So this would be retro to January 1st for services that they're already providing.
Would anyone like to make a motion for one or both?
I will move to support that
Yeah.
grant, that HDC.
Okay, this is for item 5A. We have a motion. Do we have a second?
Support.
Okay, any discussion? All in favor?
Aye.
Any opposed? Okay, and item B.
I'll make a motion to approve the granting of the public health community funding request.
Support.
Any discussion? All in favor? Yep, Jan?
Just one comment, just more of a comment about my processing, because there's one cooperation station that we didn't grant in the past, but I finally clicked into my mindset how all these things work together. And so to process some of these things for a new thing like that, it takes some people some time, and so I just wanted to comment on that I'm fully in support of it now, but last year I had issues around it, so sometimes
I think they've
change.
taken on the responsibility of supporting all other,
Mhm.
was part of the reason why we're doing this, is that there's a lot of training going in, and they're taking on a lot of that responsibility.
In terms of programming that they make available to
Yep.
all children in the community.
So some changes have been made.
And the situation has dramatically changed too, so that the need is just even more pronounced, and, Birch Birch Grove is a community school. It's not all community schools. Cooperation Station is a daycare. It's not all daycare centers, but we need to help each of these that are willing to take on the mission and serve the public, and daycare being our a huge concern in Cook County. I just fully support this request at this point in time, so I've totally had a mind shift. Thanks.
All in favor?
Aye.
Any opposed? All right. So we will move on to committee reports. Arrowhead Economic Opportunity, Myron?
Okay, I'm going tomorrow to Virginia for our annual meeting. And it's held at the Curling Center along with a community kind of welcoming function, and they have, it's really interesting, all of the providers of various services in northeast Minnesota have tables set up. And it's a pretty big day and a long day.
Arrowhead Health Alliance, Jim?
Thank you, Madam Chair, and they did not meet.
Arrowhead Regional Corrections.
No, not this. We have a meeting this Friday, but in November we'll be voting on the, wherever it is here, the mental health facility. So the reason why ARC is involved in that is because they're talking about turning Arrowhead Juvenile Center into this facility. So we'll be voting on that.
Will the juveniles still have a place to go?
They're going to build them a new facility up by NERC. So
Okay.
that's what we got going there.
Anything else? Okay. Arrowhead Regional Development Council, Ginny?
Thank you, Madam Chair. Well, we met last month, which we do monthly, except for a couple times in the summer, and one of the areas of ARDC is senior care, and they're going to be putting on a beginning workshop on transportation in the rural areas. I'm not sure who's going to represent our area, so I need to find out this week who's going to do that. Hopefully somebody else will be a part of that, and it's only the beginning. There's going to be several meetings after that, but it's going to be a large meeting to find out what are the needs within the 11 counties.
All right. And Community Health Board, we did meet, and I did not bring my packet. I apologize. I have a family thing today, so I'm not prepared to report. If you are, Allison. I mean, it was just business as usual.
Yeah, I guess the one thing I would want to point out, which I already mentioned, the approval of the letter of intent allowing PHHS and SMC, Sawtooth Mountain Clinic, to pursue the Healthy Family America evidence-based family home visiting program. And then there was a really great presentation about WIC peer breastfeeding, which I really enjoyed, and it was nice to see some familiar faces in there from our local peer breastfeeding support person through the WIC program. And it's, again, one of the public health programs that we contract with the Sawtooth Mountain Clinic. So they offer this service in conjunction with WIC, the Women, Infant, and Children program, which provides nutrition support, education for pregnant women and moms with children aged 5 and younger. And the peer breastfeeding support person is a peer support individual who is employed by the clinic and works with moms to develop healthy breastfeeding and education and resources.
Was it Carleton County that got the breastfeeding healthy city recognition, or was it Two Harbors? There was one of those two. One of them was recognized as a healthy breastfeeding community because of the places. That just came up during the meeting. And then there was an interesting discussion about homelessness that we had when we had updates from different agencies. And there was a commissioner that was talking about the homeless people in St. Louis County, and then they said, well, maybe it's not an issue because they're gone now. And I was like, they're not gone. It's cold, so they're not in the same places. But it was an interesting comment from someone that I wouldn't expect the comment to come from, because they know that the homeless don't just disappear when it gets cold. They find somewhere else to stay warm. So we'll probably get updates on that. There's in Minneapolis, which isn't part of our report. It's not our area. instead of them having their little areas, they have now joined forces and they take up a larger area together and come to, I mean, that's how they form community and figure it out. And I know that Minneapolis is struggling, so we'll see what happens as it moves north for our region. We don't necessarily see it, but we do have homelessness here. They'd be called couch surfers. It's more common for us, but.
Tents out in the woods.
Tents out in the woods and vans downtown, different places, so it's just being more aware. All right, Public Health and Human Service, Carla and Jerry.
We will meet in November.
All right. Healthcare Planning Committee, Ginny.
Thank you. We met and had some updatings from Jody at the Violence Prevention Center. October is Domestic Violence Prevention Month, so she's going to have a brown bag lunch later this month. We discussed the impact of having the Y open or the hospital open for people who need the services of plugging in a machine or whatever. And Kimber felt that they need to work out some details on that because that particular person probably would need to bring a provider with them because she's not sure if she could provide that at the hospital. So that's something else that I think needs to be looked at. And also the whole idea of getting word out there that folks can do this and call and whatever. So if we have a prevention of getting the word out, then people will know when the incident happens that, oh yeah, I can do this or that. Kimber also noted that she has a need for the director of nursing at the hospital. So she has some, needs some information from maybe the folks who applied for the nursing position here, public health nursing, might want to look at something like this, and we'll get 2 people in the community. Who knows? Let's see, Kay from Care Partners said that she's continuing her dementia presentations, and she will be going up to Hovland in that area for a little talk on that. And that's all I have.
Thank you. North Shore Collaborative, Jan?
Thank you, Madam Chair. We did meet, and it was a particularly active meeting to look at grants. And I would say it's probably the most grants we've ever looked at in one sitting, which also helped me change my attitude about this committee, because we, as commissioners, go to a lot of meetings and so forth. So we're always trying to think of efficiencies or committees maybe that could be done differently or better or whatever. But in reviewing all of these grants, it became clear to me that this committee does really great work and does some of that prevention work that we can't necessarily get to as a county. And without these folks doing those tasks, we would be in tough shape, I would say. So I just wanted to mention some of the grants that, or some of the things that we funded through LCTS, which means?
Local Collaborative Time Study.
Yes, which we participate in. So in Finland, in Lake County, we granted $5,000 for a paid coordinator for their youth programming at the Claire Nelson Center, which provides educational and recreational opportunities for kids. A lot of these are for kids. North Shore Collaborative is really all about kids, and that's where we have prioritized a lot of our attention too. So this group is doing exactly that. Cook County, $3,500 was granted to ISD 166 to improve parenting skills as identified by parents. So for early intervention, case management, early childhood, family education, early childhood special education, and Sawtooth Mountain Preschool. So specifically, this funding would go to training in the Circles of Security multidisciplinary team to certify 2 staff members at the ISD 166, Rachel Lichty and Kelly Hansen, in how to, again, improve parenting skills. So training, anytime you can invest in training to help our community members to get to the helping kids and families is a really great thing. Another Cook County grant, $5,000 for a cultural presentation in Grand Portage for the Sampson Brothers Hoop Dancers. A big event that will be probably, hopefully greatly attended. I think some 200 people were expected to be in attendance for this event. HDC in Lake County received a grant, or we approved a grant of $4,050 for Teaching Mind UP curriculum in Silver Bay at William Kelly Elementary, which really is interesting. I think they've done this before, but it's working on mindful strategies that can increase self-control, focus, empathy, and optimism, so to help teachers too. So 4 teachers in the school are interested in it at this time. And I think there have been many studies to show that mindfulness is a really good strategy for helping us in all those things. Self-control, focus, empathy, all great things. And then there were more. So Cook County Extension, Diane Booth, received $2,000 for snacks and packs backpacking programs, so providing food to 55 children during the school year in Cook County and 35 kids in the summer, Grand Portage to Tofty. The other great thing about this program, it's totally funded by donors, so I just wanted to mention to the greater people here that they're always looking for donors, and what a great program to donate to is feeding kids, because at the very basic level, it's pretty hard to learn, grow, develop empathy, all of those things if you're hungry. So this is just a very basic, great program that Diane Booth is overseeing. Another Cook County grant, ISD 166, $650 to Anna Sandstrom, the school social worker, to host a presentation called Bullying Prevention Program. This presentation will be for K through 3 and 4 through 6 grades. This is where I got the 200 people. 245 students are expected to attend that. I'm not sure what the expected attendance is in Grand Portage.
Might be 200.
It might be 200 or more.
So the bullying program only goes up to 6th grade?
Yeah. Well, that's the focus of this particular program. We could, but seriously, I think bullying, if you can reach kids at this age, it eliminates the need for older kids, for sure. I don't think bullying starts at age 7th grade. I think bullying starts at age 0, or, So anyway, getting at kids, getting at bullying prevention at an early age, anything at an early age is a great accomplishment. Cook County Community Ed and Cook County Community YMCA will receive $2,000 to support higher quality youth programming in Cook County, directly focused again at early childhood, but also day camp and after school programs, creating scholarships for families who cannot afford it. So to improve physical activity experiences, skill building experiences, character building experiences, and social skills experiences. So creating opportunities where kids can make friends and support each other in their skill building exercises. So this slate of grants in mass really helped me realize that this organization is really doing good work to get that prevention training and those resources out there to help our kids and families. That's it on that, on my report.
Jenny, emergency preparedness.
Oh. No, but Allison had a...
I was just going to add that if anyone is looking for information on how to apply for grants through the North Shore Collaborative, we're happy to share that application form and resource. Joni or I typically attend along with Commissioner Sievertson, and Joni remarked when she got back from the meeting this last month that it was a really Cook County heavy on the grants, and I think that just goes to show that we're doing a really good job of reaching out and connecting people with this resource, and happy to continue to do that. So you can refer people to either Joni or I if they're interested in how to apply for funds.
Thank you.
I could comment on emergency preparedness and Ginny and I are involved in budget meetings this afternoon, so there's an invitation to any other commissioners who want to attend the emergency preparedness meeting today at 2:00, and it's on hazard mitigation in the county, and I think that Heidi had mentioned she might be. So thank you, but other commissioners are invited as well.
You're going to go? Even in spite of your heavy day?
Yes, it's a very happy day.
Okay.
And it is pending. I'm assuming that I will make it at 2 o'clock.
Thank you.
Thank you.
I can't undo what has happened. All right, can I get a motion to adjourn?
So move.
Thank you.
All righty.
Yeah, I got it.
So you can,